here we are all together. So, you know, I have been chomping at the bit because, you know, I've been doing a lot of research over the last couple of years, and you know, I found out something really special, really, I think, important for the profession of dentistry, and you're all here to hear it. I'm great. Would you like to hear a secret? Would you like to hear a secret? Okay. Well, the secret is, hold on to your hats. There are some people that just don't like going to the dentist. Now, I know this might seem like it's a stretch and it's difficult to believe, but that's what my research has shown. So you might be saying, well, gosh, I'm here to hear a talk about lasers. What's this talk about dental phobia and all this other stuff? So I'll get to the true secret, but first I need to kind of take you down a little dental rabbit hole. So follow me. It's my bad Matrix impression. Here we are. Welcome. This is the place I call Tooth Sense. This is where the subjective dental experience and the objective dental state collide. So, what do I mean by that? Well, you're here for a dental talk, right? But there are some cues that might suggest otherwise. You know, I'm wearing a white lab jacket, and you might be thinking of all those dental experiences you had throughout the course of your life, listening but cringing at the same time. You might be smelling this smell. I don't know. It harkens me back to when I was a kid with my mouth open, getting those fillings, wishing I was able to watch cartoons instead. And then there is the music to my ears. So on the objective side of things, this is the unbiased truth. I'm wearing a white lab jacket. It's not because I just got done with my last patient. I'm wearing it kind of like a costume, just to kind of make my point. That's not the last patient I got done working on, that smell. It's eugenol. It's actually going through my diffuser. It's that typical dental smell that's mixed with zinc oxide in order to make a dental filling that you might have had when you were a kid. And then that drill that Douglas was helping me with, hold it up, Douglas, yes. That's a DeWalt drill meant for putting holes in walls, not holes in teeth. So what does this all have to do with everything? Well, let's go a little bit further down this rabbit hole, and in order to really understand the nuances and the subtleties that lasers and light bring to care, we need to define some parameters, some definitions, some parameters in order for all this to make sense. The subjective and the objective state has always been defined as very well defined ends of the spectrum. It's biased or it's unbiased. But I want to suggest that there are shades of gray. So going down this rabbit hole, just for fun, you know, you're here for a dental talk, right? But maybe you are here for a filling. Gosh, you know, I might be touching a nerve, so to speak, and you know, you might, you know, errantly bite down and break a tooth or a filling, and then I'd have to stop the talk, and we'd all have to go next door to do that filling. We need to see these different nuances of the subjective and the objective experience and state in order to really understand how I use lasers, how I think light can be used. And in order to really do that, we really need to bust through what I call the objective scenario. The objective can be objective, but the objective many times isn't objective. So when the objective isn't objective, it's because it's hidden in plain sight. Health has always been, from my experience, going through school, hearing patients talk about it, as an issue, something you have to achieve by going through some type of care. You get a condition, you get a disease, a problem, and then you get some treatment, some protocol, some medication, some supplement that brings you through to the other side, so then you can say, okay, you're healthy now. But I think that's very limiting, and especially in how this whole scenario is being used. We need to look at the individuality, because I'm in the process of writing a book, and when I've been looking at the science, I've had time because I don't have to take tests. Yay! So I can look at the science from a different perspective, and the stuff that I learned in school is based on a certain condition, a problem. So if we unwind all that entails, we can see that how we as individuals come to care is beautiful. We need to embrace those that are strong, able to go through care without any problem, and we need to also embrace those that are apprehensive. We need a sense of neutrality. We need to have the patient be able to be honored, because it's very typical, the way we're taught in dental school, the way dentists see patients as it from a certain situation, a certain condition. Did you floss today? Oh my gosh, look at those gums. How could you do this? This is really bad. Did your parents gave you soft teeth? That's really bad. You eat way too much sweets. You have to stop that. That's bad. Oh boy, wow. This tooth is bad. It's shot. We have a problem here. Well, if we see about it in this way, then we're never able to connect with the patient, and we can never expect our patients, therefore, to connect with us. So a little bit of background. I've been involved in this, I've been interested in this, involved in this aspect for about 20 years. And it started for me back probably in the early 1990s when I invested in this technology called electronic anesthesia. Electronic anesthesia was a great idea, but its application was pretty lousy. You see, the way it worked, you had this box, the source box, and the patient held a dial. There were leads that were attached to the outside and the inside of the tooth. Now, it wasn't that the technology didn't work, it's just this subjective, objective insanity that came from it. The patient would hold the box, you would explain what they needed to do. They would turn the dial. As they turned the dial, they would feel like a tingliness around the tooth. And that tingliness would then grow and the tooth would become numb. Now, if I was working on the tooth and the patient didn't know whether that they turned it up enough, was it too low? Was it my drill? Was it their inability to cope and connect with what was going on? And gosh, it was way worse when we had an apprehensive patient. So since that time, I've invested in other little things, little technologies, and I have a TLC system. It's this stereophonic multimedia system that's suspended over the patient's head, so they can transport themselves to watch a movie, see a TV show, an educational program. I can demonstrate something that I had taken on an X-ray.